with Diane Larson and Lee Conklin.
It's a disease that is extremely rare. Several kids who've survived it live in the Bryan, Ohio area.
And the reason for that has baffled doctors there. And parents want others to know the symptoms to watch for to keep their kids safe. Our Melissa Vage has the story, all new at 6.
Lee and Diane, this is a potentially fatal condition, and it normally affects children in Japan. But we have an unusually high number of kids with it in the Bryan area.
They did an episode on Grey's Anatomy.
When Jennifer Grant's son Owen was just 3 months old, he spiked a high fever for days on end. At first, doctors diagnosed it as a virus, but it got worse.
They did a lot of x-rays thinking maybe there was something wrong with his stomach.
Jennifer says his symptoms continued to worsen.
It was a parent's living nightmare, just watching him continually get worse and worse, and there's nothing I could do but watch him deteriorate.
6 days into this, doctors discovered Owen had Kawasaki disease, a rare virus that causes inflammation throughout the body.
Light bulb, like yes, he had the red lips, the red eyes, the fever that wouldn't go away, the rash on the body.
Kawasaki disease is more common in Japan, but it does affect kids up to the age of 5 here in the United States. However, it is still quite rare, except in the Bryan area, where there are at least 5 children who survived it.
If it goes unrecognized and untreated, it can be a fatal disease in children.
ProMedica pediatric cardiologist Dr. Jeffrey Moore says that can and does happen because the symptoms mimic a common virus, except
It has involvement usually of the eyes and the tongue, which you don't tend to see in most viral illnesses.
treatment with immunoglobulin therapy reduces the swelling throughout the body, but the heart is at greatest risk.
It can develop coronary artery inflammation, and that inflammation can lead to abnormalities with the coronary artery, essentially that can cause a heart attack in very, very young kids.
5-year-old Andy has permanent heart damage from Kawasaki disease when she was just 4 months old. Her mother, Carrie, says she has aneurysms where the walls of the coronary arteries have weakened and have potential blood clots.
She has aspirin every day. She gets 2 injections of blood thinners every day, and she's just very closely monitored.
While families don't expect to ever know the reason for the disease concentration in the Bryan area, doctors are curious.
I would say that is pretty rare. I couldn't give you a good explanation of why, unless, like I said, it was a certain viral illness that just happened to be sweeping through Bryan that was kind of the trigger for a number of kids to develop Kawasaki disease. But it is rare.
In Bryan, Melissa Vage, 13 ABC Action News.
And now to a 13 ABC follow-up. Toledo police say a 17-year-old is